horrible things I've seen. The Medicaid system in this state is such that if you have cancer, like cancer on the skin, a melanoma, and you're poor, you know, you make $6 or $7 an hour, you send in for an application to get on Medicaid so you can get the cancer taken off. You're rejected. And they tell you the reason you're rejected is you've got to wait till it spreads throughout your body. That's the rules of this state. It costs more money. It's the dumbest thing I've heard of. Let's go to another situation. If you have real bad diabetes, you have real bad high blood pressure, you're in heart failure, and your blood pressure is real high. You go into any hospital in this city, and they have to admit you. Otherwise, they can be penalized. But when they send you home from that hospital, they don't have to give you one pill. So this is what happens. A guy, and I can introduce you to him, he was 41 years old, had heart failure, he's admitted to the CAT, $20,000 bill. They had to admit him. He was in heart failure, real high blood pressure, diabetes. When he went home, he didn't have the money for the medicine. And he couldn't just, you know, he had just been in the hospital. He couldn't get up and start running around, filling out papers, trying to go and get into programs and things. So his blood pressure went up again. This time he bled in his eyes. And his girlfriend comes to me and says, will you write a prescription for my boyfriend, because I'm on Medicaid, and then I can give him the pills, because now he's blind. So I said, let's go down to Grady. So we admitted him to Grady. He left Grady, he didn't have $14 for his medicine. I gave him the $14. But because he was blind and he couldn't read his medicines, he went to heart failure again, blood pressure went up, he went in the emergency room at Emory. That's $20,000 for DeKalb, $20,000 for Grady, that none of them are going to collect, and $20,000 for Emory. $60,000. And if he just had the medicine, all that money wouldn't have been wasted, and he'd have his vision. The dialysis crisis is another situation. 60 people in less than 30 days will die because they can't get dialysis unless something is done. And we're advocating for that, and we're trying to get the community to pull together. These are mainly Hispanic people. I feel as though there's some nuts and bolts that I've seen as to why this problem exists. And the solution is along the lines of what these people have said. But I just want to show you the extremes of it because I've experienced it. The cost of medicine in this country are more than any country in the world. Why? This is the reason. Because if you discover medicine and it can save people's lives, you can, if you're head of the company, you say, well, let's charge $6,000 a dose, which happens for certain drugs. People will have to pay for it. There's no competition. I want to give you an example. A friend of mine started a company that came up with one of the #1 drugs for cancer, and he asked me to invest in it. And I put in $20,000. A few years later, they came out with this drug. It was a great drug. My stock was worth $300,000. I sold it. Today, it would be worth $12 million. Now, I'd rather not have that $12 million and have people getting their cancer treated. There's a certain amount of money you can make, but greed should not be part of the equation. insurance companies, it's the same thing. When we talk about doctors, doctors aren't all innocent. There are doctors who will do procedures that are unnecessary because you get more money for it. And there are hospitals. I took my child who had a nosebleed, and we have insurance, and they just looked in his nose and did a little blood smear, $700 for the visit to the emergency room. You've seen that. Let's make here. You owe me $700. I'll look on the other side. I'll have $1,400. I think what we've got to do, in my opinion, is we've got to empower people. This gentleman here taught people how to vote. Using a stethoscope is easy. You can drive a car, you can use a stethoscope. You know, you can look in an ear. People need to be empowered. And we need to use the tactics that were used in the Civil Rights Days, civil disobedience, to raise awareness. I've asked the media about this Medicaid thing. We were in front at a press club meeting. I said, how come nobody reports on this issue of somebody getting cancer and it's got to spread? Why isn't it in the papers? And they said, well, I said in Civil Rights Days, things like this would have been more in the papers. He said, well, the reason we can't put it in the papers is not the pictures aren't as visual. When it was racial, we could see blacks, whites, but we can't see anything visual, so it's not going to attract enough readership. That's what they said. I think the doctors, and there are a lot of doctors who do care, and I think that patients who have these problems, they shouldn't just go home and die. They should join with us, those patients and those family members. And all of us come together and follow people like Congressman Lewis and these other legislators here, because you guys know how to get a lot of attention. And show that we can support President Obama, and that we do have freedom of speech, and that we can create an awareness. And that's where I think the way we can make the biggest change.
That healthcare that you want. But I would be able to what? Choose the public option or maintain what I have. That's choice, that's competition, that's the way I think it should be. And I mean, I'm just responding, I'm not debating. All I'm saying is that you are happy with what you got. And if you don't want it, if you like it, keep it. You'll be able to keep it. No one is telling you what. You got to do this or that. We want you to have a choice. And that's fine. And I think that's a good thing.
The only thing I would add, it's not some mandate or whole event coming down from Washington. You have a choice. You like it, want to keep it, it's best for your family. But there's some people, more than 46 million without anything. Right. That's not any competition out there. When you don't have competition, you have these issues. Go to almost any major city in America. Who's building the big building? Who's financing? The insurance company, because they get all of the money. They're making a profit. You have a federal government involved. We can bring down the cost of not only health care, to deliver health care, but also a prescription drug. By the zip code that person lives in, the size of his bank account, of his checkbook. Health care for everybody. If I had my way, I was a czar, or a dictator. I would just make it available for everybody. That's the lead. You know, we're in the church, and the pastor would tell you, I think it's the 25th chapter of Matthew. And maybe tonight when we go home, maybe just read that chapter. And maybe sometime we should ask ourselves, as a nation and as a people, what would the great teacher do? We could spend millions and billions of dollars to make bombs. More missiles and more guns. We have more bombs enough to destroy this planet. And then each time we talk about providing